I'm Timothy Bert, MD, board certified orthopedic surgeon with a subspecialty certification in sports medicine. Grew up in St. Paul, Minnesota, undergraduate degree at Madison, Wisconsin, medical school at Loyola University, 5-year residency program in orthopedics at Memphis, Tennessee. Then I finished off at the prestigious Crillon Job Fellowship in Los Angeles. After fellowship, I did a hip arthroscopic externship for 3 weeks with the 3 top hip arthroscopists at the time, shadowing them in clinic as well as in surgery. I chose hip arthroscopy as a subspecialty because of the rapidly expanding field as well as the increased need for higher end hip arthroscopists. So diagnosing a labral tear and femoral acetabular impingement can be difficult at times. I've seen patients who come in and have seen 3 to 4 physicians and had the wrong diagnosis. They come in with a stack of medical records chasing different types of diagnosis which are incorrect. Typically what we start out with in clinic is an x-ray as well as physical exam. If I have a clinical suspicion for a labral tear or hip impingement, the next step is to order an MRI or MR arthrogram where they put dye into the hip to further diagnose a labral tear. When I'm in clinic looking at a patient that I'm concerned has a labral tear, I will use an intra-articular injection to confirm the diagnosis. Occasionally on patients who have failed physical therapy and continue to have pain but do not wish to have surgery, an intra-articular cortisone injection or some other type of injection such as platelet-rich plasma or stem cells can be administered to help decrease their pain and temporize their symptoms. So typical conservative treatment options that I employ include physical therapy, anti-inflammatories, activity modifications such as avoiding positions that bother the patients such as squats or lunges and changing how they sit, as well as prolonged physical therapy to get their core stronger, change their pelvic tilt, get their glutes stronger as well. Injections is another option as well for conservative treatment. So some of the technology that I'm utilizing today, which is cutting edge, in surgery include using postless distraction. This is a relatively new concept in which we're able to utilize a foam pad on the bed and avoid having to use a perineal post, which has a known complication of numbness in the groin after surgery and even erectile dysfunction. We've been able to eliminate the post by using postless distraction or the pink hip kit, which we now use on every single patient in the operating room. This has been able to decrease the amount of pain the patient has, as well as improve the recovery and decrease complications. Another technique that we're using in the operating room and technology is hip check. What hip check is we use fluoroscopic guided femoral osteoplasty, which is fancy words for resecting the bone on the femoral neck, which causes the labrum to tear. We're able to more precisely resect that bone now using hip check, which uses a software program that looks at how much bone to resect and make sure that we do not over resect or under resect. And it gives us a more reliable, reproducible results with our surgery. After a hip arthroscopy surgery, we typically have the patients on crutches for 2 weeks. We protect their weight bearing with 20 pounds weight bearing. Essentially that's flat foot weight bearing or foot on the ground but not a lot of weight on it. What this does is it decreases the amount of pressure across the capsular repair, labral repair, as well as allows the soft tissue to heal. This also decreases pain. We typically have you start physical therapy a week after surgery and go once or twice a week for up to 3 to 4 months until you are comfortable doing exercises on your own as well as recovering adequately to go back to a program. We typically use a hip brace after surgery called Exciber hip brace. This brace is utilized immediately after surgery for the first 2 to 4 weeks after surgery. Patients wear it at night when they're sleeping, which helps keep their toes pointing straight at the ceiling, decreasing the stress across their capsule. There's innovative straps on the brace which allow the foot to stay pointing straight up by using the internal rotation strap at night. There's also a limit on the amount of extension the brace allows your hip to do while you are ambulating, decreasing the amount of stress across the front of your hip, which allows your hip to heal quicker and with less pain. The Y strap minimizes hip distraction as well as provides abduction. Additional benefit of the brace is a hookup to a cold therapy unit, which we utilize to decrease swelling and pain, as well as eliminating the need for ice packs after surgery. This is key for decreasing the amount of pain medication you'll take after surgery. We also utilize a CPM machine in order to decrease the amount of edema or swelling in the leg immediately after surgery, as well as decrease the amount of scar tissue formation that can occur after a surgery like this, which can lead to revision surgery if this occurs. Another thing of the CPM is most patients aren't able to get into physical therapy the first 2 to 3 days after surgery, so it's a nice, if you will, at-home physical therapist working on your hip from day one. So my physical therapy regimen is actually basically a result of me being exposed to the leading hip arthroscopists around the country, and I decided to take the best parts of their therapy and combine it to make my own. My therapy involves a 3-phase approach. Typically, the first phase is decreasing pain and swelling, as well as restoring range of motion. The second phase is strengthening back to and normalizing gait pattern. And then the third phase is returning to activities such as sports, specific activities, in a pain-free way in progression. Studies show that athletes can return to the same level of activity after a hip arthroscopy, typically in the range of 80 to 90% to 95%. My approach to the patient is one of, I definitely involve them in the decision-making process. I do a thorough workup, and then when they decide to have a surgery, we use the latest technology to provide the best results with the least amount of pain, and our recovery does include CPM, hip brace, cold therapy units, all to make the recovery more comfortable and quicker and reproducible results in the end. If you think you have a tear or have groin pain, reach out to my office or visit my website. We'd love to help.